And give it a second here, but I am sharing my screen, so you should be able to see that. I know sometimes there's issues, but we'll give it a second. All right. So just as every week, this is for school staff and those associated with the schools, and for health department staff. The recording and the slides will be publicly available on our website, available in the next few days. However, we'd like to reserve the time for question and answer for those associated with the schools and health department. So if you are not affiliated, please drop off the call. Thank you. And make sure to pass along any needed information to others in your school that need it. All right. So just a few things that have come up over the course of the week. We've had some calls from local healthcare systems that they've been seeing a large influx of individuals, particularly students, seeking COVID testing, primarily asymptomatic individuals looking for testing, going to the emergency room to get testing, and they're not otherwise ill. So they just asked that we, try to discourage that, because obviously our healthcare system right now is really overloaded. So as you are encouraging people or advising people to get tested, I'll have some resources on the next slide, but to just remind them, to not go to a healthcare facility, especially the ER, if they're not ill. I did put a graphic here. There's a nice website called whereforcare.info that has some nice images and information. If you do want to have some info to help people with decision making of where to go for care. But there is still the my.gov/coronavirus test website that does have nearly all the available testing sites listed. We've learned recently that Meijer and Family Fare Pharmacies does have rapid PCR testing available. It's not on the state website at this time. There's a separate website for that. It's called doineedacovid19test.com. You just go under Michigan. There are home tests available. And again, you can always consider offering testing at the school, especially if you're doing screening testing or asymptomatic testing, and all that information is available on the state website. If you're interested in ever having a pop-up testing event just for surveillance reasons, or if you have an outbreak, you can set that up actually on your own, or we can help you with that. The information is there on the slide. There was a good article printed this week about the usefulness of COVID testing and helping schools to stay open and safe. But then I'll end all of this discussion with the caveat that because there is so much maintenance or screening testing that's going on right now, especially with new mandates to have people vaccinated or have weekly testing, we are starting to see some issues with availability of rapid antigen tests. So I say everything I just said, with that caveat that we do completely understand that there's been trouble getting access to rapid antigen testing, getting timely appointments for testing at places like Meijer or Rite Aid, places like that. So we understand that this has been frustrating, again, because there is more and more people seeking out testing to either stay in school or to not have to be vaccinated or those kinds of things. So I know it's frustrating. Another interesting tidbit, this morning on another meeting, a couple of the researchers from the ABC Science Collaborative were giving an update on that project. I've talked about this group before. This is a national effort where scientists and physicians are helping analyze school data from the last year and ongoing to try to better understand what works, what doesn't, and give best guidance. They're actively looking for more and more school data to keep adding to this. They said that they did send emails to all the Michigan superintendents within the last 1 to 2 weeks, but they're finding out that a lot of it went into people's junk folders. So they may be resending it, but just to let you know to check your email for this. But if you're interested, what they're looking for is data about cases and about your mitigation measures, and essentially data that you're already collecting and submitting elsewhere. So the workload is really minimal, and they will do everything possible to help you with it. That data is de-identified, so your school is not identified, but the information is all submitted and then compiled and compared with other schools doing different things.
So now it is.
And then you
have the email. Perfect. Okay.
If everybody could just make sure that they're on mute, that would be great. And then if you participate in this, then you actually get regular updates about how this data is looking, which we're trying to figure out ourselves how we can get that, because that's really useful data. But that's one benefit to you, is you get regular updates on data so that you know what's working and not working to help you make better policy decisions. So I put the names and the email addresses of the 2 Michigan connections for this research. So if you're interested in submitting data, so basically they're looking at, does modified quarantine work? Does regular quarantine work? Does masking work? Does not masking work? Things like that. So just want to encourage that participation. A couple other articles that were just shared with me today, I just wanted to pass along in case you're, having discussions with school boards, need any additional ammunition in your back pocket. But apparently the federal level Department of Education is actually investigating civil rights offenses against the states that are prohibiting universal indoor masking. So basically looking at if you have policies that are not protecting students that may be at higher risk for severe illness from COVID, are you violating disability laws? So just as an FYI on that, right now they're specifically looking at those states that have rules forbidding masking policies, but could this apply to any situation where there's not protection? And then this article kind of goes along with that. This is a legal review on the legal interventions to counter COVID-19 denialism. These are cut and pastes right from the article, but the material that's marked with an asterisk and in italics are just some little notes I put in there. But basically saying that putting people at risk to a deadly infectious agent through state-based laws, or you could even say, school policies, could be seen as a civil liability. I'm trying to paraphrase here. The Department of Education Secretary has said, it's negligence. Massive liability may extend from purposeful government legal interventions, or you could even say school boards, contrary to science impacting health of children and adults. So again, if you're struggling with having your hands tied, not being allowed to follow what is the standard recommendations for quarantine, masking, management of your ill students or staff, again, this is a civil liability, could be seen as negligent. So I just wanted to provide these resources as you work against these or make these kinds of considerations. In terms of our data, again, I'll direct you towards the mystartmap.info website. Additional data, we're still trying to get better county level data for our hospitalization rates. We just have the regional data, and again, some of our regions have some pretty large counties in them, so it's really hard to know what our county level hospitalizations are, but still quite low hospitalization rates for our kiddos, which is good. I did pull again the weekly COVID case rate for 5 to 18-year-olds on a weekly basis for this year compared to last year. So this is for all 19 counties that would be included on this phone call. The green line is this year, the orange line is last year. And then continuing through now, I'm going to go county by county, and this will be included in the materials you get and will be posted on our website. So again, the green lines will be this year and the orange will be last year. So note that the vertical axis has different numerical values. So just so you're aware, some of them are quite a bit different as you're comparing them. So Aranac and Clare County, Gladwin County, Isabella County, Osceola County, Roscommon County, Clinton County. We have an odd number, so I had to put somebody all by themselves. Gratiot County, Montcalm County. So we're seeing kind of that everybody kind of has that exponential curve, which is what we tend to see during surges. So hopefully we'll start to see it leveling. Now this is where I have to apologize. I am not a genius when it comes to Excel, and for whatever reason, I don't know what happened when I started with Kalkaska County. But from here on out, it'll have numbers here, but these correlate to the same dates. Everything else is correct. And I didn't have a lot of time to figure it out this morning, so I really apologize. But I did put a little guide here to let you know what these numbers stood for. Crawford and Kalkaska, Lake Manistee, Mason and Mecosta, Masaki Newaygo, Oceana, Wexford, and that's the county. So again, I will send that out, but hopefully we're going to be at a peak and leveling off soon, but we're still seeing, pretty sharp increases in that age group. So for the state as a whole, all but one county in Michigan is at a high transmission level still, and pretty much all of the United States is at a high transmission level as well. Our percent positivity of our testing has decreased a little bit, which is the first time it has done that since the summer. Our case rate, however, has increased and has continued to increase for the last 2.5 months. 10 to 19-year-olds have experienced the greatest amount or the biggest case burden of COVID right now. Each day, more than 315 cases are being diagnosed in those under 12. Last week, it was only about 80 per day, so a pretty big increase in that age group. The number of active outbreaks has gone up 30% from last week. Our hospitalization has gone up just slightly from 6.8% to 7% of all hospital beds are occupied by a COVID patient. And our death rate has been increasing for the last 7 weeks. Last week, 157 deaths occurred due to COVID. So this is our transmission levels. So still kind of on that slow increase still. Our hospitalization trends. These are the rates of illness for age groups. So this big spike here, this is our 10 to 19-year-olds. So they continue to have the highest trajectory of rate increase, followed by 30 to 39-year-olds, 20 to 29-year-olds, 40 to 49-year-olds, and then 0 to 9-year-olds here are still having increases, but are lower. Overall, since the pandemic started, 15.7% of all COVID cases have been in kids. This last week, 25.7% of all cases were in kids, down a little bit from the prior week, which was 28.9%. The amount of testing done in kids, the amount of positivity, hospitalizations, has all been pretty steady compared to prior weeks. This just broke it down by regions in Michigan, the amount of pediatric cases and change over a week. So the Traverse City region, which includes our northernmost counties, has had one of the biggest increases. More than doubled. Our Lansing region only includes Clinton County, but our other regions have increased as well. Just the northern Michigan region seems to really be increasing quite a bit. So the school outbreaks the new outbreaks from schools are 64% of all the new outbreaks that have been reported from all different areas. So there's 98 new outbreaks were reported this week. There were 412 new individuals associated with outbreaks. What I did, I know this is kind of abstract, so I plotted this as well. So I posted the link to what our definition of an outbreak is. Ongoing outbreaks are outbreaks that have still had new cases reported associated with them within the past 28 days. So the green line are the ongoing outbreaks in schools for the last 3 weeks, and the orange line are new outbreaks. And then on the right here, I put the total number of cases that have been reported in ongoing and new outbreaks. The other thing that we've been asked to report is just anytime we know that a class or a school does need to close due to a COVID-related event, they're taking just kind of an informal survey of that. So as of the beginning of the week, in the state of Michigan, there have been 71 schools that have had some type of major learning disruption. So 12 schools have closed entirely. 8 have had an entire grade that has had to close, and there have been 38 classrooms that have had to close for a period of time. And typically they go to remote learning. So I think closures maybe not the best word for that, maybe, switching to remote learning, but they're just trying to keep an eye on that. This I just threw in out of interest. It's just a plot of vaccination rates versus current rates of illness. It's kind of showing the reverse relationship that, higher vaccination rates tend to be correlated with lower illness rate. It only goes down to the 20 to 29-year-olds. I would be really interested to see, our younger age groups, what is it for those under 12, those that are not eligible for vaccination at all. But this is from the state, and this is just what they've given us. So that was the last of my slides. I will stop sharing my screen and we'll open it up to questions and answers. Okay, let me get to this chance. So the only thing in the chat right now was just a couple questions about being able to see the screen. I don't see any questions in the chat right now. So if anyone has questions, feel free to post them, or you can go ahead and unmute yourself and ask them. Otherwise, this might be a record-breaking Thursday. So the question is the health department still sending letters who need to quarantine? So when we do find out about close contacts, typically, and my CD nurses on the call can correct me because sometimes things change in each individual health department depending on our load of cases. But when we do find out about close contacts, they get entered into TraceForce, which is the state contact tracing system, and they do send them a letter. You know, it's not always the most timely thing, but that is the information they get. If schools are doing different quarantine options, like I know some are following the state option of testing out at 7 days, you know, those different options are not in the letter from the state contact tracing group. It's still the standard 14 days or potentially 10 days as an option. But we're fine, and I took the slide out, but there was some data from the state about how we're finding out less and less about contacts, even though people are more and more mobile now. Fewer and fewer contacts are being reported for each case that we do learn about. So we're having less and less success with contact tracing at this point. Who can sign a face mask exemption? Does it need to be a physician or a PA? Can the nurse practitioner sign it? Since there is no executive order, there is no official rule, but I did write a sample rule for you to use as a guide, and kind of the medical opinion is it can be an MD, a DO, a physician assistant, or a nurse practitioner, and within their scope of practice. So, you know, if you got a note, this is a really off the wall example, but if you got a note from an orthopedic surgeon saying someone didn't have to wear a mask because they have asthma, like, to me, that's not legitimate because it's not within their scope of practice. But that would just be an example. But yes, any physician or physician extender, which would be a PA or a nurse practitioner, again, that's with practicing within their realm of expertise, could sign it, unless, again, you wanted to make different rules, which is your purview, but that's what, you know, we would suggest. This question is in regards to reporting a COVID positive case for school. If the school has already been, if the student has already been at home because of quarantine, do you still have to post the COVID positive case if they had already been at home, but not at school when they tested positive? Okay, so if you go to that order from October, you have to report online school, I think it's called school related or school associated cases. So there's cases that have occurred that could result in transmission within the school. So basically, you need to report on your website any case that could have caused transmission of illness at your school. So if they've been in quarantine for 5 days and their symptoms started on day 5, they would not have ever been at school while they were contagious. Therefore, you do not need to put that case on your website. If they went into quarantine today, they were at school yesterday, and their symptoms started later on today, you would have to post that because they would have been contagious at school. So basically, anyone who could have been contagious in your building or your event needs to be posted. If there was no way they could have spread disease at your school, you don't have to post them. So hopefully that makes sense. For the 7-day test out of quarantine, can it be a rapid test or does it need to be a PCR test? It can be, and that's the state's recommendation. They actually intend it to be a rapid antigen test, and they actually allow for it to be a home rapid antigen test. So that information is in their guidance. So, any other questions? All right. Well, we will get this material out to you and get it posted on the website as well. As usual, if you have questions in the meantime, let us know. And have a good rest of your week and a good weekend. Thanks, everybody.